Hi, I'm Dr. David Greene, CEO of the U.S. Pain Network, where we connect those in pain with pain clinics throughout the country. The topic today is how to treat adult scoliosis non-operatively. So when you have scoliosis in adult, it typically comes from one of two mechanisms. The first is you may have had scoliosis as an adolescent. Now if you did, and it got to say 40 degrees or so, and you were just getting into being skeletally mature, you may not have needed surgery. But studies show that if you have 40 degrees or more, that in adulthood it's probably going to get worse at the rate of 1 to 2 degrees per year. Doesn't sound like much, but if you're 17 and then 40 years go by, if you had a 40-degree curve at 17, and then you add another 40 degrees, that's 80 degrees. That can be a lot, and it can be very painful as it gets worse. Okay? The other way that adult scoliosis can occur is if you didn't have scoliosis as an adolescent at all, and it just starts to develop into adulthood. Well, the down and dirty on that is that these disc spaces can start to degenerate as you reach your 30s, 40s, 50s, and then subsequently these joints in the back of the spine, called the facet joints, one on each side, they can get arthritic as well. That arthritis often does not occur symmetrically. So if it occurs worse on one side than another, you can start to get an imbalance and develop scoliosis. Well, what are you supposed to do about it? Because it can produce significant back pain as well as leg pain. Because if you get overgrowth of the soft tissues around these spinal nerve roots as they're coming out, it can pinch on them and cause sciatica pain down one or both legs. Well, surgery itself can be very effective. It can cause you to have less back pain. It can cause you to be more functional. It can take away the leg pain if you free these nerve roots up. But as an adult, you just don't handle it as well as you did possibly when you were an adolescent. It can have a 65% complication rate or higher. It could take 6 to 12 months to rehabilitate from that surgery. So it's not an overnight kind of phenomenon, and you should definitely think once, twice, 3 times, before undergoing it. So what can you do non-operatively? Well, here's the options. First and foremost, over-the-counter medications. Anti-inflammatories and Tylenol should be your friend. If you take them according to the manufacturer's recommended dosing, there's a small incidence of complications with them, but they can really help. Okay? So, and if you're going to take them for a long time, make sure you're under the treatment of your physician with that. But for the periods when it's exacerbated, when it gets really bad for a few weeks, short-term opiates, narcotics, under the direction of your pain management doctor, can be very helpful. Okay? That can really help, keep you working, functioning, socializing. Okay? Shouldn't take them for the long term, because for long-term use, narcotics, the risks outweigh the benefits. You can get addiction, constipation, tolerance. Those types of things should be avoided. All right? And muscle relaxers I put in the same category. For periods of exacerbation and spasms, you can use muscle relaxers for the short term. Physical therapy can be very helpful. Bracing does not help for adult scoliosis because it's not flexible anymore. It's not like it was when you were an adolescent. Okay? So when you do physical therapy, it can strengthen up the muscles around the spine, help take some pressure off of the arthritic areas, and achieve some pain relief. Chiropractic treatment can also be helpful. It's not going to fix anything permanently, but it can give you substantial relief around these areas of arthritis. Okay? Now, interventional pain management. This can make the big difference between whether or not you're going to need an operation. So if these nerve roots are being pinched in certain areas from the spinal arthritis overgrowth, you can get spinal stenosis. Pain can shoot down one or both legs. It can go into your buttock, into your hip, thigh area, and it can be really problematic. But an epidural steroid injection or a series of injections in the areas that are getting pinched can make all the difference. Okay? So that's one interventional procedure. Now, for these arthritic joints in the back of the spine, the ones that are overgrowth with arthritis and pain, what you can do is a procedure called a facet injection at the areas that are painful, or a medial branch block. It's very simple. One, the needle goes in the joint, the facet joint injection. The other one just goes around it and can provide pain relief for weeks to months. Okay? If that works and wears off, another procedure that can be done is called a radio frequency ablation. And that just heats up the areas around the joints that are painful, and that can provide 12 to 18 months of pain relief. Very impressive. And studies show that if it works and then the pain relief wears off, pain comes back, a repeat procedure gets the same result. Okay? So that's the good news. So less than 10% of individuals who have degenerative scoliosis as an adult will end up needing a procedure for it. Okay? Quality of life procedure doesn't have to be done, but you really should try all these other things first. Check out our website at uspainnetwork.com. There's a lot of information on pain conditions, treatments, and if you need a pain clinic, just type in your zip code or click on the map, and it'll show you the clinics that are closest to you. Okay? I'm Dr. David Greene, CEO of the US Pain Network. Your pain stops here.